You are listening to episode 28 of the EU Startups podcast, today with Dr. Fiona Pathiraja, the founder and managing partner of the European VC firm Crista Galli Ventures.
Hello and welcome to another episode of the EU Startups podcast. Today we're really excited to be joined by Dr. Fiona Pathiraja, who is a partner of Crista Galli Ventures. CGV is a fund that invests at seed and Series A startups in the European health tech scene, and it's a doctor-led evergreen healthcare fund. Dr. Fiona herself has a really interesting background, which I'm excited to learn more about today. She worked as an NHS consultant for over 15 years before turning her hand to investing, as she was frustrated by the lack of innovation in the hospital environment. I think that we can all agree and draw on our own experiences that sometimes the healthcare system kind of has let us down. And indeed, the pandemic has really shone a light on the different challenges facing the healthcare sector across Europe. So Dr. Fiona set up CGV to help drive innovation from the outside in and improve this sector for everyone. And the fund already has an impressive pan-European portfolio of health tech startups. Alongside this, Crista Galli Ventures is also working hard to tackle the issue of diversity in VC. And partner Dr. Fiona is herself a woman of colour, a woman of diverse background. So Dr. Fiona, very welcome to the podcast. Thank you for joining us today.
Thank you for having me today, Patricia.
Yeah, so Dr. Fiona, you began your career as an NHS doctor and now you're a managing partner at CGV. Can you tell us how you made this kind of unconventional career change? What led you to working in the VC space?
Sure. So, firstly, I loved working in medicine. It's a huge challenge, and every day, however senior or junior you are, you're really making a difference to the patient in front of you on a daily basis. But as a young doctor, I started getting more interested in the wider picture of healthcare and started thinking, where do I fit into this hospital, into this ecosystem that's around me in the bigger picture? So I took some time out of medicine. I worked as a management consultant. I spent 2 years in the UK Department of Health developing health policy. And, I started really thinking, gosh, I really want to change healthcare for the better. And I had lots of different ideas. I finished my training as a radiologist at University College London, and I was working as a consultant, so an attending radiologist. And along the way, I'd got a master's in public health and I did an MBA at London Business School. So when I went back after the MBA to be a consultant radiologist and try and make change in a big hospital, it was actually really challenging. And somebody said to me very early on, look, this is a big organization and it's going to take a lot of time to make change in the way that you want to do it. So I quit my job in 2018 and started investing a little bit, very low key, just to try and see if I liked investing, if I understand health tech a bit more. And as I sort of started going more and more into this sort of investing space, I started to realize, gosh, a lot of people investing in healthcare are not healthcare experts like I am. I really understand what patients are looking for, what physicians are looking for, what nurses, etc., are looking for. And then I also started realizing there's not that many women here. There's not that many diverse people either. So I decided to start Crista Galli Ventures in 2019 in order to address some of these things in healthcare. And sort of that's the story. So it's really a story about wanting to make change in healthcare and realizing that VC is a way to help shape that future at scale by backing incredible founders.
Wow, it's really inspiring. And I think it's a really important point that you made there as well, the fact that there's so many people making these decisions about where the money goes for new innovations in health tech, but it's not actually people with a medical background making those decisions. So it's a really important point, I think, to note that and to highlight that as well. And then also, as you say, that you got there and you're like, where's the woman and where's the diverse background? So it's certainly a very inspiring story. So CGV is, of course, backing founders across Europe. Can you tell us a bit more maybe about the direct aims of the company? What exactly is your long-term vision?
Sure. So Crista Galli Ventures is a pan-European health tech specialist VC. We're based in London and Copenhagen, and we're backed by a Danish family office called IPQ Capital. We're really investing in founders who are shaping the future of healthcare. And by that, we see this future as a tech-enabled future with really incredibly empowered patients who are using these tech-enabled solutions to have a healthier and better life. And really, we have deep networks into healthcare and to investment circles in Europe, UK, and the US. And we try and leverage these networks to try and help our startups to grow and scale across Europe and then hopefully in the US as well.
Interesting. Okay. So one of the main things I'm hearing is bringing tech into patients' lives. And that does align with some of the trends we've seen in health tech this year in terms of a lot of funding going for companies that are enabling more people to have apps to receive medical care in their homes. Would you see that as kind of one of the bigger trends in health tech this year?
Yeah, of course, we can't ignore the pandemic and the 2 years of what has been happening due to COVID. And of course, whilst terrible things have happened due to COVID, there's also the opportunity. And the opportunity there is that literally everybody is talking about healthcare. Whether you're an airport worker or a politician or somebody sitting in a restaurant, everybody's talking. Suddenly it's like, everyone's talking about lateral flows. Everyone's talking about PCRs. And people, I think that sort of health literacy piece is really powerful. And now doctors are more accepting of tech-enabled healthcare, and so are patients. And I think that is a real opportunity for step change in health tech.
Wow, yeah. So absolutely, the pandemic really exposed, I guess, the challenges in health tech and how much the industry needed to develop more digitization and more tech-enabled solutions. So after, we've had the pandemic, 2 years now? 2 years of global health crises. What does the health sector really need to do now to stand up to the challenge of recovering from the pandemic, number one, but also dealing with all the fallout of what's been like longer waiting lists and things like that in the NHS, for example?
I think that a lot of my friends still work in the NHS and, they're doing incredible jobs during very difficult times. I think that there is a lot that is happening already in healthcare, given the pandemic, the sheer sort of force of nature of these people who are working at the front line. And I think that beyond that, the technological impact is great. So, for example, we invest in 3 key areas: deep tech, so AI and machine learning in healthcare, digital health, and personalized medicine. And actually, across all those areas, there's a lot happening now at the level of government and policy to try and make things easier for companies to help develop things in collaboration with the NHS. So NHS have developed something called NHSX, which is a large organization deploying millions of pounds to try and work with startups so that hospitals and startups can work together to improve tech-enabled solutions. In the US, the US is opening the door for reimbursement for AI software because, it's great to have all this technology, but who's going to buy it? And if a hospital group can't pay for it or can't buy it, then it's sort of not really useful for these companies to make it. So policy changes are happening across Europe and the US. And in Germany, there's a new sort of policy called DIGA, which is a digital health policy to try and get the green light for specific digital therapeutics to be prescribed by your doctor. And I think that the pandemic has really shone a light on the fact that, back in the day when I was a young doctor, we didn't realize that actually how essential we are to society. You just sort of think I'm doing a great job, but suddenly, you start being recognized as an essential worker, a key worker. I think that's really powerful. And I think that governments have started to realize that actually these are key workers, essential workers, and also there's not enough of them. So in order to, make their lives easier, to help them do their job, we need the tech behind them to be really top notch, whether it's the computer systems they're using or whether it's, AI being used to read CT scans.
Absolutely. I think, there's so much there that we can unpack, but I absolutely agree. It's incredible the power that the pandemic has had to recognize the importance and the essential nature of healthcare staff. So it's wonderful to see now that they are getting that recognition and getting that tech that they need to bring the best outcomes possible to patients. The other thing as well I would like to just quickly touch on is something you did bring up with governments, yes, are inwriting these now more into policies across Europe and the US. Is there the possibility that a lot of this really innovative, exciting tech could create a bit of a gap between wealthier patients and the patients that have less money? Or how can we make sure that these innovations and these tech solutions are accessible for everyone?
Yeah, I mean, in a short answer, yes. And I think that that is the danger of tech that is just, rolled out without thought. So I think that that's the key. We must roll out any technology or trial it in a very methodical manner, looking to important issues. Like, I trained in public health before I went into radiology when I worked in government. And, a lot of stuff around health literacy, can people read this? Can they understand it? Can they digest what you're sending out in these messages? Can they, if you're creating a digital health app that's only available on an iPhone, how about all the people without an iPhone? How about all the people who are on Android or don't have a phone? So it's really important to think about this. I think it's a key issue you touched on. And as an investor, it's our role as well as my role to ask and question the tech companies to say, how are you working with hospitals, healthcare systems to make sure that this isn't just something that, an affluent person is going to use, but it is reaching all levels of society?
Absolutely, that's great. So that kind of brings us into this idea of the health gap. So a health gap is kind of defined as the difference of the prevalence of disease or health outcome or access to healthcare across different groups. So we've touched there on people of differing wealth backgrounds, but it also exists between men and women. It also exists between different ethnicities. In fact, in 2016, a study found that women with dementia, for example, receive worse medical treatment than men. There's also studies showing that women are less likely to be given painkillers, and they're less likely to receive health monitoring and so on. So how can we address this? How can we make sure that men and women are receiving the same level of health care? Is there anything that CGV is currently working on?
That I think is a core issue as well. And actually, from a personal point of view, I've recently been a patient and realized that actually, if I don't go out saying, I am a former consultant radiologist in the NHS, the doctor is treating some of my concerns as though they're a little bit histrionic, or, they're sort of minimizing my questions. It's only when I'm showing them actually I am the same, I'm educated at the same level as you, that actually they're taking me more seriously. And that is quite shocking to me. But putting that in some ways to one side, as an investor, my role is to also make sure that some of these things are being thought about, right, by our startups, because it's really important that they meet the right networks within healthcare and try and meet people who are champions for change, because by their very nature, a lot of the people who are going into working in health tech startups are, idealistic, want to make positive change, and they've come to healthcare to help people. So of course, most people will not be there to sort of, cause a problem on purpose. It's often the unconscious bias that happens, whether it's about women or people of color or whatever it is. So it's really, I think a key way to address this is to ensure your company is diverse from top to toe. So whether it's the founding team, the first employees, the investors, who's on your board, the advisory board you have around you, it's to make sure that there's diversity of thought. So somebody's going to ask the hard questions around, are we addressing women's needs here? You're making this amazing AI algorithm that's going to read CT scans of people with stroke, but have you tested it on the brain scans of Black people or women or people from a socially deprived background?
Absolutely. So it's really about making sure that each kind of startup or each innovation that comes that way has really considered an intersectional picture of what they're treating.
Exactly.
Very interesting. And so across Europe, recently there's been a rise in what's being described as femtech, so health tech companies focusing primarily on women. Do you think that's the way to promote greater gender inclusion in healthcare, or is there a better way to go about it?
I think I don't like that term femtech. I think it's pejorative. And I used to be, my area of expertise in radiology was gynecological oncology, so women's cancers. So to see all of, that badged as femtech, it just seems ridiculous to me. But having said that, I do think having female-led, female-focused companies working on female issues is really important because, I have seen in hospital as a physician, lots of the innovations, the technology, the kit that we're using is, on women is designed and developed by men. So of course, it's great that now there are a lot of female-led companies working in the, female health space to try and champion some change. So it's not, we're not there yet, but I think it's a positive step in the right direction.
Okay, interesting. So things are moving in the right direction. We just need to keep up the momentum in that case. So what do you think is the next big thing in the health tech space? And how can we keep up this momentum?
I think some of the things I'm excited in as an investor, first thing is community-driven health tech. So at the moment, we've got these big tech giants in healthcare who are delivering telehealth services based on a general practice model. So, you would go with any kind of issue to your GP and try and get a telehealth solution to it. But actually, just as individuals today online, we're seeking communities online, whether it's on Twitter or Instagram or whatever. People also want these tailored solutions. So, we want things that are tailored to us. So examples of this, there are startups now providing online care, which are beginning to specialize and treat specific communities. So Fella Health is somewhere I have an angel investment in. It's a Y Combinator-backed telehealth service for men with obesity. And then there's Lavender, which is an online sexual health platform for LGBTQ plus people. So I think that is an area that actually people are starting to get more interested in. And I certainly, as an investor, believe that the personalization of health isn't just about these tailored genomic therapies. It's also services that are tailored to an individual's needs to help understand what the LGBTQ community need or what, pregnant women need specifically.
Wow, interesting. It's really interesting as well to think about this idea of the personalization of health. I think as well, so in terms of, yes, it makes sure that we're touching on specific community groups and specific groups and the problems that they have, but also just for patients as well to make sure that they receive a treatment that they feel more comfortable with, that they believe that they are being taken more seriously, I think for a long time in healthcare, a lot of patients have felt kind of that they're just put in the system and they're treated very quickly and impersonally and then left. So it's interesting to see a new wave of bringing personalization back into medicine. Because as you said, people become doctors to help people and for a reason. So it's great to see tech kind of promoting that again. So alongside these gaps that we see in health tech, there's also a big gap in terms of diversity in the VC space. So I was wondering if we could just touch on that for a second. Have you experienced diversity in the venture capital world?
Do you mean a lack of diversity?
Yes, the lack of diversity.
In short, yes. So when I started investing, I started thinking, where are all the women here? And that's because I was really investing a lot, both as an individual and as a fund, in deep tech companies across Europe. And deep tech is a place where it is very white, male, straight investors. And actually, a lot of those people have been to the same university or the same school and is very homogenous. So I very much was like, gosh, I'm the only woman and the only person of color on this cap table, which really stood out to me because medicine, for all its issues, is a very diverse, field, both in the patients you see and the people you see in hospital. And then I think I've had some interesting experiences. So I was mansplained about radiology and the need for artificial intelligence in imaging, despite being a radiology expert. And this is by people who are non-experts trying to tell me what radiology is, etc.
That's slightly shocking, isn't it? Just the audacity.
Yeah, so that's an interesting thing but then it's not just about recognizing it, it's also about calling it out in a nice way and trying to say, actually, I am an expert and I do know what I'm talking about. Men have asked me who's writing my check for me, because they're assuming somebody else will. So I think I learned from my time in medicine, that if you're good, if you're credible, you shouldn't have to hide away. So I very much took the initiative and leaned into this. So I stepped up onto these cap tables as the only woman, the only person of color. And, you know, I'm not shy about talking about how much I know about healthcare and, you know, my expertise as well.
Absolutely. And nor should you be. You have had an amazing career and a lot of experience. And that's definitely a very inspiring piece of thought. And so related to this, how do you think that we can get VC space in Europe to become more diverse? How can we make sure that 2022 is a year that we have a diverse area?
So I think we need to look at the sort of status quo. And the thing that comes to mind is the Atomico State of European Tech report that came out at the end of last year, which shows that 1.1% of all VC funding in Europe goes to all female teams, and only 8.8% or something like that is going to mixed gender teams, which means, you know, we have a long way to go. And I think that, you know, there are a lot of great initiatives now where people are, you know, holding office hours for underrepresented founders, where they're mentoring them and sort of trying to support them in different ways. And I think that's great. And we need people to be talking about this as an issue. But we also really need to back underrepresented founders with money, you know, with capital. And I think that is really important. And I think that a way that people can do that is to turn the mirror onto yourself as an investor. You know, are you sitting in an investment committee full of people who look just like you? You know, are you investing in startups where, you know, where are there any female founders? Are there any people of color? Just to try and figure out your own status quo and then decide, okay, this is the next level we need to go to try and change things.
Interesting. Okay. So it's about taking awareness of where you're at and identifying the problems, and then really, I guess, putting your money where your mouth is and giving the investment to those teams that are driving innovation.
Exactly. And at Crista Galli, we have an initiative called Crista Galli Labs, which is a standalone investing strand, which allows us to invest in exceptional pre-seed, very early stage companies backed by otherwise traditionally underrepresented founders. And I've been doing that since 2019. And actually, some of those companies are doing really well. They've had follow-on funding from people like SoftBank, Amadeus Capital, Hoxton Ventures, etc. And I think that it's basically, my thinking here was to back these people at the earlier stage, because I think that that's the time when they can be overlooked and, you know, not invested in, despite being great.
To help them get that first step on the ladder and get going.
Yeah.
Absolutely amazing. So based on this then, what kind of would inspire you to invest in a startup? Was there any special spark that you're specifically looking for?
I mean, if I look across our portfolio, our founders are very different in terms of personalities. It's not one personality per se. I think that we're looking for outstanding founders who really understand healthcare. And that sounds very glib, but actually it's really hard to do because healthcare is a complex regulated environment where it takes a long time to get an innovation from an idea into a patient's hand or onto a ward. So I'm looking for people like some of our best founders, like Neil Daly at Skin Analytics, for example, took literally years to figure out the whole space, you know, for dermatology, artificial intelligence, to realize what do doctors want, what do patients want, what is going to work best here. Because there's no point having an amazing piece of technology that's going to sit gathering dust on a ward. You need that person to understand how to make it inside hospitals and healthcare in general. And then beyond that, I'm looking for people who are creative and who have grit and resilience. This characteristics, of course, really important during the pandemic, because, you know, the pandemic hit a lot of our startups, you know, hard. Suddenly you can't travel, you can't do your research, hospitals are shut to anything other than COVID. So, of course, you know, if you don't have grit and resilience, it's very challenging to sort of move forwards in difficult times.
Absolutely. Okay, so we need to have a lot of know-how and a lot of creativity and a lot of grit and determination.
Yes.
Okay, and then just to finish up, do you have any final words of advice that you would give to any up-and-coming or aspiring founders, particularly those that are from diverse backgrounds?
Yeah, I would say don't be afraid to shout about yourself and your company in the same way that a straight white male founder would. I find this is especially the case for women founders who don't always want to shout about how great they are. I would say, secondly, to build your own community of founders and investors who are backing you from an early stage and lean on them through difficult times. You know, don't be afraid to be vulnerable and to ask for help if you need it. And then finally, I think from a more cash point of view, especially at the earlier stage, find out who invests in diverse founders and engage them early on to become champions of you and your business.
Wonderful. Thank you. Well, this has been absolutely amazing, Dr. Fiona. You've given us so much, and there's so many things that I would love to have unpacked further, but I feel like we would be here all day. So thank you so much for joining us. It's been a pleasure.
Thank you very much for having me, Patricia.